So often I see people being put on pharmaceutical medications without being told all the side effects of that medication. One of the best examples of this is Coumadin, also known as warfarin. The name warfarin comes from the place that it was first discovered, in Wisconsin. The WARF part of warfarin stands for Wisconsin Agricultural Research Foundation. The way it was found is that cows that were eating out in the field after it rained were dropping dead. When they did autopsies on these cows, they found they were bleeding to death internally. It was finally linked back to the sweet clover that was in the feed, and during the rain it was starting to ferment, and during the fermentation process the coumarins that were naturally present in the sweet clover were changing into what's called dicoumarins, which are very, very powerful blood thinners, and thus the development of Coumadin. The biggest problem with Coumadin that people are not being told is that even though this is a blood thinner and is most often prescribed to help prevent strokes, is that the drug can actually cause strokes. And I've gone through the physician's desk reference and looked for this information, and they even hide it in there. If you go through the PDR, nowhere do they mention the fact that it can cause strokes. The closest they get to saying this is it can cause uncontrolled hemorrhage from any organ in the body. Well, this includes the brain, and this is where the strokes come in. There are different types of stroke, including thrombic stroke, which is what Coumadin is used to treat, which is basically a blood clot causing a blockage in an artery inside the brain. There's another type of stroke that's called hemorrhagic stroke. Hemorrhagic stroke basically means that you are bleeding into the brain, and the brain gets compressed, cutting off the blood supply to the brain and causing the stroke. This is where Coumadin comes in. Coumadin will thin out your blood vessels. You'll notice that people that are on Coumadin, they can just barely bump into something and they bruise real easy. That is because Coumadin breaks down the tissues. It thins out the blood vessel walls, and when you bump into something, you rupture those blood vessels, blood leaks in the surrounding tissues. So by making those blood vessels very, very thin, they're more prone to rupturing. This includes the blood vessels in the brain. If for some reason the blood vessel inside the brain thins out and pops inside the brain, not only are you going to have a bleed into the brain, you're going to have no way for that to naturally clot. Pressure is going to build up in the brain. It is going to cause a stroke. And this is why the Coumadin can cause strokes, but patients are not being told this.